All right, here we go. All right, something exciting for you here. Who can tell me what this says?
Germs is not all yuck.
Okay, so we're just going to spend a little time talking about the germs. And when little kids talk about germs and it's all yucky and ugh, and a child's behavior is very interesting because they seem to like to explore orifices. What does that mean? They like to put their finger in their nose, and they like to put their finger in all different parts of their bodies, and that creates a conundrum of where infections can rise. But I'm not going to talk about that right now. We're going to talk about something very interesting regarding what relationship do we have with bugs. Do you folks know that bugs, we have good relationships with them? Well, we can have good relationships with them. And we're going to look at that right now. So let me see here. So first of all, we have something called the human microbiome. The human microbiome. All the bacteria and fungi and viruses and all the organisms that we have in, around, and on our bodies. Trillions of them, trillions of bugs. I'm just going to use the word bugs because that's the way when we're talking to kids, we talk to them about bugs or germs. And we are just replenished with all this bacteria and lots of organisms, microorganisms. And you know, it's not all that bad. And we may be perceiving because of the environment that we're in. And I ask you the question, how many times have you washed your hands today? I mean, pre-COVID, probably, you know, you may have washed your hands before you got, no, after you go to the restroom, before you, some people may be, because the studies have been shown that very few people wash their hands before they go to the restroom. I don't want to show off hands now, but I'm just telling you, data shows that most people don't wash their hands before they go into the bathroom. And let me just give you a side. Recent data from 2019 showed that 75% of university college students went in the restroom and never washed their hands. What age group is that? 18 to about 25, went in the restroom and never washed their hands. And I'm going to give you one that's going to frighten you out of your days. Observing people in the airport who entered the restroom and came out. The professionals, and I'm not going to mention any names, the professionals in the environment, when they were asked the question anonymously, have you washed your hands before and after? 30% said neither. Are you listening to me? So we have so now that we're in COVID, I'm sure that you're washing your hands sometimes 10 times, 15 times a day, and now you're washing it better, right? We've learned this technique, 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 right? We've even learned this technique. These are things in medical school that we learn when you're going to prepare for surgery. Now people are doing it in their homes and they're taking 20 minutes and lathering up and all this fancy stuff. So we've gotten to another side of understanding, but I want to bring us back a little bit to not go off on a tangent thinking that all that's microscopic and microorganisms are negative, because they play an important role. Did you know that 10% of your genetic material is yours, listen to me carefully, and 90% of your genetic material around and in you is not yours? So who has the 90%? It's all these bugs that I'm showing you here. You see in the stomach, the lactobacillus, the streptococcus, the Staphylococcus, the Enterobacteriaceae. In the duodenum, you have the Lactobacillus, you have the Staphylococcus, etc. And in the jejunum and ileum further down, and in the colon, that's where you have a mega load of bacteria, very important Fusobacterium and other Bifidobacterium. So the objective here is not to get carried away with words and terminology. And you may or may not know, but the reason why they use these long, big terminologies was back in the early days of medicine, the priests and the bourgeoisie wanted to speak a language that the peasants couldn't understand. And so they used this form of Latin so that we couldn't understand what they were talking about. But basically, these are just bugs. And bacteria of different shapes, have different types of metabolism, live in different environments, require certain types of foods. So that being said, that 90% of your genetic material is not yours. It's from our friends, the bugs. That 10% is ours, meaning then we have to be careful how we treat our friends, the bugs, because really without them, we cannot live. So are we getting into a situation now where we're wiping and washing away all our friends that we need to keep us going? I don't know. This is really interesting. There are things, as you can see from the diagram on the right, where you live, your mode of delivery, if you had a cesarean section versus a natural birth. Diet, very important. Exercise, lifestyle, the amount of gastric juice you have, the use of antibiotics, which can definitely affect your level of balance of microorganisms, the movement of your intestines and your stomach, which is gastric motility, your age, because as you age, your bacteria changes. When you're born, you're almost sterile, meaning that you have no bacteria, almost. And as you get older, by the time, when you smell a baby, pardon my language, but when you smell a baby's poop, is that what they call it still? When you smell a defecation, let's use that word. When you smell a baby's feces, in the first day of life, you parents that you're out there, what do you smell? Does it smell bad? It does not smell bad. You can smell it and go, that's my wonderful baby, my newborn baby. You hug your baby, you even take care of that diaper with not much problems. But within 2 months of that baby having breast milk or formula, when that baby let go that number, the whole house, the whole room is empty. Everyone's running away and you're holding it like this. Don't act like you don't do that. You know you did that. That's your wonderful child that you'll die for. But the smell is very strong. The reason why that smell is very strong is because of the types of bacteria that are now growing, which is going to have a beautiful relationship with the gut and your immunity, the defense of your organ and your organism, the communication, neural communication. So gut communication with your brain, gut communication with your lungs, and we can just keep going on and on and on. So we have a gamut of things, and lots of things can affect it. Did you know that even your genetics affects the kinds of bacteria, even the stress load? So if you look at different races, if you look at different families, you have different types of bacteria that live in there. And check this one. Every family has the same kind of poop. Study the feces, and you'll find that when you move into a new home, and you check the types of bacteria that they have, you've now moved into this new environment. You're going to then take on the same type of bacterial environment internally and externally. That's very interesting. And so we want to look at some interesting things to do with the microbiome. And so we have in the mouth, we have function as mucosal production, mucus production, antimicrobial chemicals. It assists in digestion in our mouth. It wards off pathogens. In the lungs, lubricating our lungs and tissues, prevents gastric complications in the stomach. This is all the good stuff that this can do for us in the colon, digestion of complex carbohydrates. So you think you're digesting the food, you think you're taking care of it. Let me say to you that in your intestines, specifically in the colon, those bugs, without them, we would be lost, because they not only help us to do a very complex digestion, but they also help us in also communicating to the different cells what their needs are. Very interesting. They communicate our needs, and they can actually decide how much of what we need. It's crazy. Even sexual organs, it maintains the right pH, right type of peroxide production, enough to kill microbes. So our private organs need certain types of bacteria to keep us healthy and hygiene. Our skin, our skin is the largest organ in the body. We need a lot of help. Can you imagine without bacteria what your scent of your sweat would be like? Oh, good heavens. Let's not start that one. So we need bacteria to help us to modulate and actually break down certain bacteria. So we have good and good and bad bacteria, but I don't want to talk about bad, because without that balance, we need the balance. We need the balance between good and bad, if you want to call it bad bacteria. And I've mentioned before how you can mess that up with your lifestyle. Now, we also mentioned that there are illnesses that you can actually acquire because of our misuse of our environment, or the misuse of our body, or our genetics, or our environment, or our stress. A person who is stressed will actually have changes in their bacterial colonization in their stomach, in their throat, and literally when they're exposed to viruses or bacteria, they can succumb to infections just because we have changed the balance by stress, because certain hormones actually can modulate what type of bacteria like cortisol can live in our throat or in our nares, etc. Even when it comes to our weight and metabolic syndrome and insulin resistance, there is a relationship between the bacteria that exist in our stomach and also what we eat and how we affect them. And then there's the interesting, beautiful concept of how in the gut, if you look at the end of that slide at the bottom, you see gut microbiota, and you see that all the bacteria and microorganisms affect the lining of the intestines and later go on to direct communication to our brain. So there's a direct relationship between our intestinal bacteria growth and our brain. And needless to say, we can have an inflammatory type balance of microorganism that can then send cytokines up into signal into our brain, and then we succumb more to viral infections. And so I just wanted to mention a few of those and open up a few minutes that we may have to talk about the bugs and us. Does anyone have a question or comment? Or there may be someone here that knows much more than I do about it. And we can discuss that together, because there's so much to talk about here. And today I wanted to have an interactive format.
Okay, let me hear what Fitzroy saying. Okay, thanks, Ben. Bye.
Is this a time we can ask about a problem?
Sorry?
Hello?
Yeah.
I think the niche is asking.
Can we ask a question now?
Yeah, sure. And this format is not for anything personal. It's more a general thing, because we don't want to get into anyone's personal situation. Go ahead. As you know, because medical information is very private. Please go ahead.
Oh, sorry. My internet is acting up. Right, can you hear me?
Yes.
Yeah,
we're talking about the gut.
you.
I wanted to ask a question about IBS. Is that appropriate now? If you can tell me a bit about it and what you can use if you suspect that's what you have.
Yeah, so
And
the
how
question,
related is stress to it? How much you think stress contributes to it?
yeah, very, very good question. And thank you for that very specific question, which is very opportune at this time to mention that there are different profiles of different illnesses when it comes to the gut or the intestine, the bowels. What we've seen in the last 25 years, because this area is newish, but not that new. It's been developed over the last 25 years, but in the last 10 years, a lot of information has been looking at association. So I want to make very clear, most of the findings that we have when it comes to the study of the microbiome and illness profile is really based on association, not direct cause and effect. And to be specific to your question, people who have or who develop IBF, we're not sure if it's the chicken or the egg, so that's another point. They seem to have also an inflammatory profile, a certain type of certain types of bacteria or microorganisms, and a certain type of mucosa, which is the covering of the intestine, which is very distinct from people who have normal intestinal linings. But we find that there's a genetic predisposition in these people as well, meaning that there are families that seem to be associated with the same illnesses or types of illness, not necessarily IBF, but also other types of inflammatory disorders as well. And so specifically, your diet has to be an anti-inflammatory diet, which is anti-Western lifestyle, point blank. Because we have very much so a very much inflammatory diet, which directly affects our intestines. We also have an inflammatory, pro-inflammatory neuroendocrine lifestyle. So someone who is overworked, overstressed with family situation, financial situation, academic situation, and we can just keep going on, their cortisol levels, their adrenaline levels will be baseline higher than normal. This will directly affect the types of bacteria and the balance of microorganisms that they will have in their bowels. This will also affect the gut and the endocrine and neurotransmission that occurs between the gut and the brain. And so these people, there's direct association between IBF and depression. And one of the links that we have felt that could be an association, it could be through the gut. And so protecting the gut may be a way to even decrease the amount of depression and also subsequently decrease the amount of inflammation that goes on. And so IBF in itself, IBD also is also something that seems to be family genetics, but also lifestyle.
Thank you.
Sure.
Any more
Talking
questions?
about myself, who else would like to ask something or discuss something or mention something?
Hi, doctor. It's my wife's name there, Carol. So this is a man, not a woman speaking. Yes, just to talk about some of the things you mentioned this morning, which are very good, and the sleeping pattern. And last night, actually, you spoke about the sleep and the sleep pattern. I was thinking, because myself, I am a vegan. I don't eat meat and chicken and fish and that type of thing. But it's really getting the last meal in is part of my challenge, because I'm quite active as well with my work, and I find that I can eat, like, 8 o'clock and even 9 o'clock of the evening. Sometimes I may go to bed a little bit later, but it's just trying to get something that is sustainable, that I don't feel like, for instance, if I can have the last heavy meal or good size meal, I shouldn't say heavy, because the heaviest one, as you said, should be in the morning, but to have a sustainable meal, last one about 6:30 or something like that, then I don't feel hungry, you know, before 10 o'clock. And that's my challenge, because if I stop eating at that time, by 10 o'clock, I'm hungry and I can't go to bed on a hungry belly. You see, that's my challenge. I just wondered if you had any advice.
Did you see I showed a graph with the types of hormones that affect our desire to eat, our appetite. After around about 9 o'clock or so, ghrelin and leptin, which are hormones that suppress our appetite, they come out if you go to sleep. Listen carefully. If you go to sleep, that suppression occurs.
Mm.
If you don't go to sleep, guess what happens?
Mm-hmm.
Your appetite blows up. It just gets excited and give me food. And we all know that. Imagine you eat a meal at 6 o'clock, 7, 8, 9, 10. It's a natural biological rhythm after 4 hours for your stomach to be empty and your bowels to be almost empty again, and you're going to eat. And so this is a big problem, because if you think about this, when you eat, you are using the power of a third of the hepatic or the liver drainage to allow blood to go to the intestines, move through the liver, go around your body, and you got to do that for a good 2 hours and you've eaten. And so all that has to happen. And so you are really putting a lot of stress on the body later on in the evening. And so what happens is that you will end up staying later if you eat later. And here comes the problem. People who don't get good sleep, and we are all chief of sinners though I be, Jesus has shed his blood for me, but I've not only claimed that, I've decided to change that. And listen to that. Not just claim it, but what? Change my behavior. So there were times when in medical school, not even medical school, there were crazy times when they had no laws and regulations on students when in medicine, where I'd see my wife, my young wife, on Friday, and I'd kiss her and say, darling, I'll see you on Monday. And I'll be on call from Monday, just Friday, Saturday, Sunday, and Monday morning, I'll be still on call. And I may get 3 or 4 hours sleep in between. And that was crazy. And I was dealing with people's lives. And comes the end of the day, and the chief resident or registrar says, well, where you going? You haven't finished your charts yet. After 4 days. Now, that lifestyle gives you this, but also affects your health. And so even though I may be a vegan, or you may be a vegan, or whatever, et cetera, or we've chosen wonderful things, decisions that we've made in the past can and will have their impact later on in life. And many of those things, such as sleep, whenever we depreciate the quantity of sleep, it affects directly our lifespan, how much years you will live. And it's said clearly in most research done right now that people who have had a chronic sleep problem will live 2 to 3 years less. Now, we know of situations where it can be much more, but we're just being very conservative here, just because of the fact that we have not had good quality sleep. So I think that we have to find a way to put that meal in and put it in strong and go to bed. Now, there are some decisions in life. Do I need 2 cars, or do I just need 1 car? Or can we just survive on a bicycle? Or do we need to leave where we're living and live somewhere else so we can literally spend half of that money on our mortgage or our home, et cetera, et cetera. And so there, and hence, I don't have to work so many hours. We literally have to make major changes, but it depends on what that means. You know, these are major statements.
Yes, thanks, doctor. Thank you.
And also, Dr. Graham, it's interesting that you said that, because most of the most of the medical papers that I would have read about sleep would suggest that those who work permanent nights, some people who work permanent nights because of family problems, it's easier for the wife to work night or the husband to work night and that kind of stuff, to reduce your child care. it's proven that their lifespan is a lot less than a person who works mostly days.
Yeah.
So sleep is very, very, very important to how we get our health and longevity of our lives. Now, there's another question that was asked to me earlier. What do you say, or what would you recommend to a person who complains of dry mouth and dry eyes all the time? Now, I know that might be a big question, but that's a question that's being posted. Dry eyes and dry mouth, chronic dry eyes and chronic dry mouth.
Okay, so first of all, you need to speak with your primary care provider, because you may have an underlying disorder, which is not just because you have, oh, I just always have a dry mouth and I'm always thirsty, or I have dry eyes. It may not just be that. It may be that you have an underlying disease or disorder. There are certain syndromes, rheumatological illnesses that you may have. You may have metabolic disorders. You may have neoplastic disorders. I could go on, but there are, and apart from that, whenever you put eyes and mouth together, you need to seek medical attention. There are other organs that can also give rise to dryness as well, and even burning sensation. And so yeah, there are certain illnesses that are specific, such as rheumatological, immunological, and metabolic diseases that you need to speak to your provider about, because it is possible, especially with dry eyes and dry mouth, that you're carrying an underlying illness that has not been diagnosed as yet. However, one has to be careful, because with the eyes, you can drink water and be well hydrated throughout the day and take care of the drinking thing. But if you have an underlying disorder with your eyes or your mouth, you can drink until the cows come home, you're going to have a problem. So you need to be careful, especially you may get eye disease or even blindness after a while because of, or scarring of your cornea because of the dryness in your eyes. So yes, we need to address that by getting evaluated. Thank you for that question.
I think Burns has a question.
Yes.
Hi, I was just unmuting. Hi, Dr. Fitz. It's Bernard, your good old friend from back in the day.
Oh, my brother.
It's such a pleasure to hear the knowledge just coming through, man. I'm wondering whether you can just throw a little light on the fact that there's COVID going on, and you mentioned about how the colon speaks to the lungs. You know, the vasoactive intestinal peptide. Can you just add a little bit of stuff to that, so people can see, hey, how good it is to get your bowels running and you know, fighting disease like pneumonia and things like that. How have they used that, or how can we use it?
Yeah.
Is that
Well, I think, go ahead, finish.
Yeah, would that be useful to just expound a little bit on it, so that people can take advantage of it?
Yeah. Well, there's a lot to be said on that. I think that you put me in a spot, Brenner, because I'm writing a lot of things on that right now, so I don't want to. But I'm trying to find a way to reduce that.
Yeah, I got that. I got it.
Let me see now. So let's put it like this. It is, first of all, let's just simplify this. Since the colon has the majority of bugs or germs or microorganisms, our best friends that we need to have with us, we need to know how to live with them and respect them. We are very disrespectful. What do I mean by that? Our lifestyle, our eating habits, our genetics, our epigenetics, how we modify those are what's going to decide what signals and what immune modulation can occur between our intestines, especially the colon, and certain types of cells in the lung which act to eat up organisms. I'm trying to break that down.
Yeah, good.
So what we need to be careful then is, for example, sweeteners. You guys call it sweeteners, like Activia and things like that? Okay, sweeteners, products that are highly processed. I'll give you an example. An apple is a whole plant. Apple sauce, which is okay, but it would be a processed form of it. Okay, and then you could even go further than that. You have a banana, you have a boiled banana, and then you could all the way go down to a packet of crisps, banana crisps, right? That's what they have. Okay. And And then you have some things that are not food even. Like patients come to me and tell me, oh, you know, my kid eats this. And I tell them that's not food. It's not hanging on a tree. What are you talking about? That's not food. Okay.
Yeah.
So that's not, these are things that they make in the laboratory. It's not food. And there's nothing on it that's food. Those kinds of foods distinctly kill the types of bacteria that we need in our colon and other parts of our body to keep the right balance so that one type of bacteria does not overgrow, or the environment is not changed so that the wrong type of bacteria grows, because there's certain good bacteria that send signals to other cells. It's a beautiful thing that God has done.
Yeah, amen.
And it's through bacteria, bugs that we don't like, and we're washing
Amen.
off. I hope that I just tried to distill that. Sorry.
Yeah, thank you, brother.
Pleasure.
Yeah. And ask another question, Dr. Graham.
Yes, sir.
This is just an arbitrary question, but you know, as well, like my wife, my son, when he was growing up, and he puts his hand anywhere, the first thing he gets is wash his hands on the water and blah blah blah. He does anything, or wash his hands before he eats his food. But you go other places and you see other kids run around, touch the floor, eat as per normal. And I actually read somewhere ago that it's good for germs, allow germs to get into the body because it makes the body stronger. And that's one of the hypotheses why black kids get more leukemia than others, but not more prone to leukemia, because as you're growing up, you don't get the bugs that you need to get into your body, pass through your system. What do you think about that? Are we too clean, or should we be a little less clean?
Yeah, and that's why I started this, because I need you folks to help me. You know, yeah, they may say I'm an infectious disease specialist, but without you guys, I don't know anything. So that's why I talk to you folks, because those ideas and those thoughts get you thinking, you know. And that's why I started out by saying that what we're doing now, I mean, I never, outside of a medical situation, washed my hands like this and like this and like that. If people saw me doing that when I went to their home, they'd think, hey, listen, you might as well not come in, because, you know, what do you think? So, because that's not normal behavior, but we're doing that. Everybody's doing that now. What does that mean? Could it be that we're gonna have a pre-COVID microbiome and a post-COVID? Well, we may have a pre-COVID microbiome, a COVID microbiome, and a post-COVID microbiome. So when you analyze my profile, you see that I have different types of bacteria at different times. I think it will be the case. What will happen will be, because of my lifestyle, will I have an edge? Will I have an edge of trying to regain the right kind of balance of bacteria and organisms than someone who does not have the right kind of lifestyle? And be careful when I say lifestyle. A lot of people use the word lifestyle and they think, oh, you got to eat this kind of way. No, listen, there are studies that show that people who smoke 1 pack of cigarette a day, but do moderate to severe exercise, live longer than people who are vegan and have normal body weight, but don't exercise. Are you hearing me?
Nice.
So somebody who exercises moderate to severe, but smokes a pack of cigarette a day is gonna live longer than someone who's sedentary, but is a vegan and has normal weight. Because normal weight doesn't mean anything. Normal weight could be your genetics. And just having a diet is just part of the situation. You can have a wonderful diet, but have a lot of stress in your life and be working 12 hours a day. And you will have not only mental illness, autoimmune illness. So that is why the Adventist message is something that we need to be pushing now about health, because it's a holistic, balanced approach. And anyone that comes talking about, oh, we just need to be doing this, that's a big problem. Because if you look at what Sister White has spoken about donkey years ago, she's spoken carefully about us having a balance, that we need to be balanced. And we should not be judging anyone because of health-related issues, because they're going to be people in the kingdom that we never thought is going to be in the kingdom. We're not going to know because we're not there. Okay. Oh, that made everybody silent. Sorry.
Doctor, someone asked me to ask a question.
Go ahead.
She said that her body is feeling cold inside and it comes and goes.
Yeah.
Always feeling cold on the inside, but it comes and goes. What can you advise about that?
Okay, that's a good question. A lot of people may have issues with that. That's quite complex, but it can be distilled to some basic things. First of all, are you male? Are you female? Don't answer those questions. We're not going to deal with anything personal right now. Are you male or you're female? Are you a child? Are you a young adult? Are you a teenager? Are you a middle age? Are you elderly? All those things can tell us, give us a better perspective. Do you have underlying illnesses? Is there any family associated? So a history, are you taking any medications? You know, all these kinds of things go into play. So generally speaking, when someone talks about this kind of thing, after you get all that information, you start zeroing in, and it tells us that that person needs to really take a look at their underlying health. Do I have an underlying illness or disease at this time that could be pushing me in a certain direction? Because it's not what directs your temperature are certain receptors which give response to hormones, to your amount of fluid you have in your body, to the exterior temperatures, to internal temperatures, to your blood flow. All those elements are involved in regulating your temperature. And even the thermostat that we have in our brain could be messed up, just like how the thermostat in your home. If the thermostat is messed up, no matter how you change the numbers, and no matter how much you change the electricity, you're not going to be able to modulate your temperature based on what's going on outside or inside. But generally speaking, number one, you need to be evaluated properly to be able to zero in on what that could be. But what you need to do in the meanwhile, you definitely, and that also depends on your age as well, you need to be hydrating during the day continually, every half an hour or so. Make sure you're drinking half a cup or so of water, and you make sure you're doing that frequently throughout the day, so you don't end up at 6 o'clock saying, oh, let me drink 12 cups of water that time. It's not going to work that way. You have to help yourself during the day, because that's going to help the way you sleep at night. Your hydration in the day, and I spoke about that. I recall your hydration in the day is going to affect how you sleep at night and the amount of times you wake up in the night as well. Because a lot of people think, okay, I got to drink lots of water. I spoke to Dr. Graham and he said I need to drink, and at 6 o'clock they start drinking all the water in the world, 4 o'clock, and then they spend the whole night up going to the restroom. And you know, that's not productive. So we want to make sure we do that. And then exercise is one of the best ways to regulate temperature, but also depends on your age. But regardless of your age, at least 150 minutes a week of mild to moderate, not necessarily exercise, but physical activity. Could be gardening, could be brisk walking. That's the kind of thing.
Thank you.
Pleasure.
All right, Pastor. I'll dot another question. I've been asked before about colonic lavage. So we're talking about bugs in the intestines and in the body. What was your take on colonic lavage?
I think that
For those who don't know, a colon washout.
Yeah, I think that there's a place for that. But remember, when we started this all up, I think you saw my first slide.
Yeah.
Right? The germs are not all yuck. And remember, 90% of our genetics, our genetic material comes from our friends, germs. 10% is ours. So we are basically all microorganisms, bugs, bacteria. So you try to wipe them all out, I'm not sure what you're trying to achieve. However, there are moments where that may be beneficial in certain situations for a short period of time. But the wrong thing to always do is to be trying to get rid of the very important bacteria that are in the colon, which is the majority, which will help regulate our pH of our blood, regulate the neuroendocrine communication between our different organs, and especially our immune function. Oh man, be careful what you're doing. So we need to be balanced about that.
Well done.
I had a hand up. Can I ask the question?
Yeah, you can answer a question actually, Bernard.
No, Fitzroy, I would really like your advice as a infectious disease person. I've been advising patients. I've been saying to them, look, if I was going to go in the ring with Tyson, I'm not going to choose somebody like him to practice. I'm going to get someone that's less than him, get me up to a certain level, and then I'll deal with him. So I apply that to the germs. I'm saying, right, it's true that we're sanitizing everything, but the opposite, people are saying, oh, get acquainted with germs, all right? People who just come from the toilet, shake their hands, put it in your mouth. You know, you're on the bus, you know? But I've seen people, right? You go to Tesco's or to Sainsbury's, they go to the toilet, they don't wash their hands, even doing number twos, and then they go and handle your fruits that you're gonna eat. Now, these are the Tysons. You don't want to be dealing with them. That's how I'm thinking. So I tell them, hey, avoid those. Sanitize, wash your hands, you know, when you do this. But if you're growing a few things in your garden, don't wash them. Get familiar with dirt germs, like the kids do, like the babies do when they're touching the ground. So you're growing a tomato, you're picking a carrot. That will challenge your immune system and keep it active. What do you think? What's your view on that? Is that the right thing to say?
No, I think it's you know, they used to say, is it the 5-second rule or the 2 second? Well, how many seconds does everybody have there? You drop a piece of food on the floor and, oh my goodness, let's pick it up with you. I don't know. You know, we know that exposure to microorganism is essential for life. Before the last 30 years, we did not understand the extent. And that's why I look at the developmental microbiology of the babe, the infant, the child, the teenager, etc. Because as you move along, your exposure to bacteria increases and matures your immune system.
Yeah.
And a 2-year-old, guess what? A 2-year-old, their height allows them to be near to nature. Amen?
Amen.
Right. And they can get hit with lots of illnesses, but they don't get, a kid gets an ear infection, they run around just the same. And the dog gets an ear infection, they're in the bed, oh, I can't take it anymore. They're dying. You know, it's because the immune system of a child is different. People think it's not as robust, but the difference is it handles it because it's been prepared over time to handle that type of thing because of the exposure of microorganisms. So there is a place that we need to have a rustic exposure to life, like what we had before, which is the way Bernard mentioned it, which is literally when you look at the, and I think I gave a talk in this series on the 5 places in the world with longevity, correct?
Yep.
And when we looked at those people, if you look at their lifestyle, the majority of them are still involved with contact with nature.
Yeah.
And that's very, very important. If we move away from our contact with nature, and I'm going to close my thoughts on that, this is where we run into problems, because if it's all concrete and steel, think about this carefully. We are really, really shaping, and oh, I didn't tell you this. There's a profile of microbiome for those who live in the city and those who live in the fields.
Wow.
That is another area that we need to be looking at, because then there's a relationship between people who live in the cities and their longevity, how long they live, and people who live in the fields and how long they live as well. Not only that, when they do get illness, because everybody dies of the same kinds of illness, the Adventists who live 7.2 years longer than their counterparts in California, Adventist vegan vegetarians lived 7.2 years longer than non-Adventists. Those people, but they're just not vegans, vegetarians, they're people who are involved in a whole lifestyle. Those people also have their exposure to nature has been taken into account as well. So nature has something to do with being in contact with nature, has something directly to do with our lifestyle, our bacteria as well. So we can keep going on.
Thank you, brother.
Yeah.
I think Pastor has a question to us.
Yes.
So Elder, I always wanted to ask this question. Constantly forgetting your keys, going to check if you lock the doors, calling your children by the wrong names, is that, I mean, sometimes calling all the names until you get to the right one. Is that a sign of early dementia or something? How do you explain that?
All right. So, you know, when a container of powder falls on your head, like myself and yourself, Pastor, well, that's what we'll just say, some powder fell on us, right? This is a sign of seasoning of our brain. We've been seasoned. And so it's a beautiful concept that there's something called pruning. Just like when you prune a tree. When you're very young, you explore everything. And you stick your finger into the socket in the wall and get electrocuted, but you do it, and you'll do it again, you know? And you'll jump off of a wall and fracture your leg, but you'll do it again. The reason why you explore is because you have a lot of neuronal material that's spread all over, lots of connections. But as we age, pruning occurs, and you may call it wisdom or you may call it experience. You no longer stick your finger twice into the socket. But with the pruning, so you become more very targeted in your knowledge and specialized in your approach because of the fact that you don't need to experience that much anymore. So you don't live by experience, you live based on your experience, not by experimenting. Now, why am I mentioning that? That pruning, which brings you to that point, you've clipped off lots of what? Neurons and their dendrites and their axons. And by clipping off those connections, this is what happens after a while. We seem to maybe, we don't have so much power when it comes to memory and long-term memory. And so it's one of the offsets that we have for having lots of experience in the past, but we're not experimenting at this time in our life. And so it takes a toll on us because of the pruning. So our volume of neuronal tissue is decreased. And that's why the brain as you age, gets smaller, it shrinks. So what does that say about my brain and your brain, my brother? Okay.
Thanks for that, Elder.
Yeah. But we praise God for our experience because the young people need our experience so they can continue experimenting with some guidance.
Okay.
Hi, Dr. Fitzroy. Hi. Yeah, just going back to what you were just saying to Pastor Thorpe. In regards of our brain shrinking as we get older and the memory loss that tends to set in, would you say, which I've heard and I've experienced, exercise really helps with your memory, the circulation and everything? And that's why you even find when people get older and they've been keeping themselves like well exercise and active and all that, you find that tends to stimulate and get the circulation going and the brain starts to function even better.
Yeah. Thank you for that comment. It's a very profound statement you've made there. And as I said, we mustn't be micromanaging our health. So it's not just exercise, it's the whole approach. Because remember, someone who has studied, and this is for all the people who are studying, someone who studied until 2 o'clock, 3 o'clock in the morning and got it all in and sleeps 2 or 3 hours and wakes up to do an exam, it's better off for them to have slept from 8 o'clock.
Yes.
With the little knowledge that they have, they will do more and be able to produce more with more sleep than someone who has burnt the midnight oil thinking that they've covered more material, but their ability to retrieve information and manipulate the information is decreased by 60 to 70% because of lack of sleep. But then, this one thing aside, but going back to your point about exercise, exercise is one of the components, a beautiful component that can help to preserve our function of the brain. But remember that the pruning that I'm speaking about, when you're clipping off as you age and you decrease the volume of the brain material, the little that we have as we age, we can use more efficiently. You heard the statement, don't work hard, work smart. Well, that's what they say over here. I don't know if you guys have it over there. People don't want to work hard anymore. They want to work smart. But that's what we, as we age, we tend to work smart.
Thank you. Thank you.
Yeah.
Thank you.
All right, guys. Any more questions? We have room for one more question. Anyone else?
Okay, since no one else is asking, I'm going to ask another one. Doctor, thank you so much for all your advice. What would you say to someone who has excruciating, unmovable pain in their left side, and it goes right down to their back and down to their left leg, and every time they use the washroom or releases gas, the pain goes away, and that happens like 5-6 times throughout the day? What would you say to that person?
Well, all I can say is that you don't have a happy life. I would say that first. That's not a happy life, and I would not be sitting around with something like that. And again, based on the sex, if it's a male or female, if it's a child or an adult, or someone who has had pre-surgery, post-surgery, someone who's had other types of illnesses, any genetic factors, the use of medications prior, all those things would play a role in that differential diagnosis. And when you have a situation where your pain moves in your body, and if it moves when you're not doing anything, and it moves when you're doing something, and it's just on one side, you have to be careful about that. Why? Because there are organs in that area, there are different systems in that area as well, different structures in that area that can be problematic, can be inflamed, can be neoplastic, can be neurodegenerative. The list goes on and on and on. And so you want to be careful, because pain can be referred. You can have pain from something that's originating in your groin that sends pain up to your shoulder. You have pain that's in your left side that can giving you pain up in your head. And so this kind of thing you don't sit on. We don't live in the 1940s or 1920s, and you're in a first world country. You need to get that sorted out. People talk about the good old days. Well, the good old days, people never used to live until they were 45. They used to die. Majority of the population died when they were 45 of pneumonia, and 1 or 2 lived long. So the good old days may not be that good old days. Now people are living average at least 70, 74 years, 75 years, and live in quality life. So we need to use the system that's available to us to help us with these very difficult, specific medical situations that need attention.